Uh, Today, we're going to talk about the vessels of the body. Can you see the slides? Mhm. Okay, very good. At first, when we want to see the vessels of the body, we have to remember that the main vessels of for the participants who cannot see the slides, please exit the room and enter again. Uh, all the main vessels are starting from the heart or they are carrying the blood to the heart. So it would be better, okay, I will speak slowly. It would be better to start the beginning part of the vessels of the body from the heart. In last sessions, we have talked about the coronary vessels. I mean the vessels which are supplying the blood, for the heart muscle. But today we are talking about the other vessels, the arteries, and for the next session about the veins. Before that, if we take a look on the chest cavity, we can see that all the parts of the big vessels are covered by pleura, lungs, pleura, and the pericardium, and also by the thymus gland. Okay? All the beginning parts of the big vessels of the heart are covered by the lungs, pleura, pericardium, and thymus gland. And if we want to see or to take a look on the vessels, we have to, listen please, we have to put them over to see the big vessels. But at first, we are going to talk about pulmonary trunk. The pulmonary trunk is an artery which is starting from the right ventricle. The pulmonary trunk is branching or starting from the right ventricle. It is near 4 centimeter in length and 2.5 in diameter. So 4 centimeter in length and 2.5 in diameter. Here is the conus arteriosus part of the right ventricle. Conus arteriosus part of the right ventricle. And after that, we have the pulmonary trunk. The pulmonary trunk's direction is to the up or superior, dorsal, and almost to the left. So its direction is superiorly, dorsal or posterior, and almost to the left. The aorta is placed on the right side of the pulmonary trunk and also it is more anteriorly to the pulmonary trunk. On the right side and anterior to the pulmonary trunk, we can see the aorta. Okay? After this 4 centimeter, the pulmonary trunk is dividing into 2 branches. Here also we can see the heart and big vessels. Look at here, the pulmonary trunk and aorta. So the pulmonary trunk is placed on the left side of aorta and also more posterior. Some of you don't have the slides, but I don't know what is the problem because the others have them. So you have to exit the room and enter again. I hope that the problem will be solved. And if you don't have the slide, you can ask Mr. Fassi to send you the slides. And now look at the slides on your phones or everything and listen to my explanation. I will tell you the number of the slides. Okay? The pulmonary trunk is dividing into 2 branches. Maybe. Yes, I think so. Left pulmonary and right pulmonary arteries. Left and right pulmonary arteries. The pulmonary trunk is dividing into these 2 arteries just under the aortic arc. Listen please. This bifurcation of the pulmonary trunk is occurring just under the aortic arc. Here we have the aortic arc and here we have the pulmonary trunk bifurcation. The right pulmonary artery is passing posteriorly of the aorta, but it is placed anterior to the right bronchus. So it is placed between the aorta and the right bronchus. But on the other side, the left pulmonary artery is placed anteriorly to the descending aorta. It means that the aorta is changing its place and direction from anterior to left and posterior. When the aorta making an arc and also making the descending part, it is changing its direction from anterior and right to the posterior and left side. So because of that, the right pulmonary artery is behind the aorta and the left pulmonary artery is in front of the descending aorta. Can you hear my voice? Everybody, can you hear my voice? Okay. All the things which are going to the lungs we can see them in the root of the lung. I will see you a slide, okay? The pulmonary arteries, the bronchus, and also pulmonary veins. I will show you the root of the lung. I said that the direction of the aorta is from anterior and left to posterior and anterior and right to posterior and left side. Listen please. The direction of the aorta is from anterior and right to the posterior and left side of the midline. So the right pulmonary artery is placed behind the ascending aorta, and the left pulmonary artery is placed in front of the descending aorta. They are both in front of the right and left bronchus. Right and left bronchus. Here also we can see that the aorta, the pulmonary trunk bifurcation is just under the aortic trunk arc. At the embryonic period, there is a link between the arc of aorta and the pulmonary trunk. In the embryonic period, or the embryonic or fetal circulation, there is a link between the aortic arc and pulmonary trunk. Look at here, this white part. We call that ductus arteriosus. We call that in the embryonic period or fetal period, we call that ductus arteriosus. But it would be closed after birth. When the lungs are starting their function, these ducts will be closed. So after that, it would be called ligamentum arteriosum. It means a ligament between two arteries, pulmonary and aorta. Ligamentum arteriosum. Look at here, this white part is the ligamentum arteriosum. After birth, when the lungs are starting their function, the ductus arteriosus would be closed and its name will be ligamentum arteriosum. In the embryology class, I will explain about the ligamentum arteriosum and ductus arteriosum more to you, okay? So, here we can see the root of each lung, the right lung and the left lung. Look at here. Here we have the bronchus in both sides. These are the blue ones, are the pulmonary arteries, the right pulmonary artery and left pulmonary artery, and also the pulmonary veins, the red ones, are the pulmonary veins. Here we have the root of each lung. So in the lungs, we can see that the pulmonary arteries are placed in the right lung in front of the bronchus. But in the left lung, it is superior to the left bronchus. This is the root of the lung. And in the lungs, we can see the capillaries, as you asked. In each tissue, like spleen, like lung, we have the capillaries. But you know, in the capillaries of the lung, we would have the exchange of gases. CO2 and O2 gases would be exchanged in the alveoles of the lungs. Look at here, we have the pulmonary artery, the blue one, which is carrying the deoxygenated blood to the lungs. And in the capillaries, the gases would be exchanged, and we have our veins, pulmonary veins, which are carrying the oxygenated the blood with O2. These veins are carrying the blood to the left atrium of the heart. They are carrying the blood to the left atrium of the heart. And we have two pulmonary veins on the right side and two on the left side. Look at here. So this view is the view of the capillaries of the lung. Now, let's see the aorta. We have said that the pulmonary trunk is starting from the right ventricle, and the aorta, which is one of the biggest vessels of the body, is starting from the left ventricle. The muscle of the left ventricle is much thicker than the right ventricle because the left ventricle should send the blood to all parts of the body, but the right ventricle is just sending the blood to the lungs, and it's a short direction, short distance. But the blood have to go to all parts of the body like head, like limbs. So the muscle of the left ventricle is much thicker than the right ventricle. The aorta is also branching from the left ventricle, the conus arteriosus, and it is placed on the right side of the pulmonary trunk. The aorta is placed on the right side and also in front of the pulmonary trunk. It has three parts: ascending aortic arc and descending aorta. Listen please, the aorta has three parts: ascending, which is starting from the left ventricle, aortic arc, and descending aorta. The ascending part is just 5 centimeters in length. The pulmonary trunk is placed on the left and behind the ascending aorta, and also we have the superior vena cava on the right side of ascending aorta. Okay? The direction of the aorta is from the right side to the left and posterior side. So it is going from the right side and anterior to the left side and posterior. The first part, look at here, we can see the direction in this slide with a good view from anterior to posterior. Anterior and right to posterior and left. Pay attention please. If we draw a hypothetical line from the second cartilage of the ribs to the T4 or T5, the T4 and T5 vertebra, the disc between T4 and T5 vertebra, I mean the sternal plane. I have explained that for you in previous sessions. Okay? We can see the arc of aorta is starting from this sternal plane and also ending at this sternal plane. So the beginning and the end part of the aorta's arc are in the same plane. Listen please. We are drawing a plane from the second cartilage rib to the disc between T4 and T5 vertebra. This plane is the beginning and the end of the aortic arc. So the aortic arc is starting from a plane and ending to that plane, a same plane, the sternal plane. Mhm. So the ascending aorta, we said it's just 5 centimeter in length, and its branches are just the right and left coronary arteries. The branches of the ascending aorta are the right and left coronary arteries. The ascending aorta is placed in the fibrous precardium. The ascending aorta is placed inside the fibrous precardium, and just at the time the aorta is going out of or exit the fibrous precardium, its name is the aortic arc. Mhm. From this side we can see the aortic arc. So if you don't open the fibrous precardium, it means that you cannot see the ascending aorta because it is placed inside the fibrous precardium, and its branches are just the right and left coronary arteries. The arc of aorta has 3 branches. It has 3 branches, one in the right side of the midline. It is slide number 9. One in the right side of the midline, and 2 of these branches are on the left side. The first branch of the aortic arc is called the brachiocephalic trunk. The brachiocephalic trunk. Here. Brachiocephalic trunk, which is placed in the right side. The second branch of the aortic arc here is the left common carotid artery. The left common carotid artery. And the third branch right of the midline. Midline of the body, the sagittal plane, the mid-sagittal plane. The third branch of the aortic arc is the left subclavian artery, this branch. Okay, I will repeat the branches. I said that the aortic arc has 3 branches. The first one is in the right side of the mid-sagittal plane and is the brachiocephalic trunk. The second branch is the left common carotid branch, and the third one is the left subclavian artery. Left subclavian artery. These three branches are deriving from the aortic arch. No, it is not burn. It's a cadaver. In the left side, we have the left common carotid and left subclavian arteries. These two are on the left side. Subclavian artery, left one. No, he were not smoker. In cadavers, the color of the cadaver will be in like this because of the formalin and other fixatives. Okay? Look at here. In slide number 10, we can see some vessels which are passing in front of or passing through the aortic arch. One of them is the phrenic nerve here, which is passing through the arc of aorta, and the other one is the vagus nerve. The phrenic and the vagus nerve are passing through the arc of aorta. In this picture, we can see the vagus nerve, and also on the anterior side, we can see the phrenic nerve with precardiaco-phrenic vessels, which I explained them today. The elements which are passing through the arc of aorta, which are passing in front of the arc of aorta, one of them is the phrenic nerve with precardiaco-phrenic vessels, which I will explain today, and the other one is the vagus nerve. Here we have the arc of aorta, and these are the elements which are passing in front of the arc of aorta. Also here we can see them. Look at here the arc of aorta. This is the vagus nerve. And this one is the phrenic nerve, a nerve for the diaphragm. Phrenic nerve. They are passing in front of the aortic arch. Listen, please. If we look the chest, we can see that the beginning part of the brachiocephalic trunk, it would be better to say the whole length of the brachiocephalic trunk is placed inside the chest. But on the left side, we have the common carotid artery and left subclavian artery. The beginning part of these arteries are placed inside the chest. But on the right side, the common carotid artery here, the right common carotid and the right subclavian arteries are placed outside the chest because they are branching from the brachiocephalic trunk. At the level of sternoclavicular joint, the brachiocephalic trunk would divide into two branches, the right common carotid and right subclavian arteries. So we can't see these two arteries on the right side in the chest. But on the left side, the beginning parts of these two arteries are placed inside the chest cavity. I said if we do not open the chest cavity, we cannot see the brachiocephalic trunk. This trunk is placed inside the chest and at the level of sternoclavicular junction, this trunk would divide into two branches. One is right common carotid artery, the other is right subclavian artery. But in the left side of the chest, we can see the left common carotid and left subclavian arteries. Inside the chest, the beginning parts of these arteries are placed inside the chest. Now let's talk about the subclavian artery. The subclavian artery is supplying the blood mostly for the upper limb. The subclavian arteries are mostly supplying the blood for the upper limb, but they are also sending some branches to other parts of the body. For example, one of its branches is the internal thoracic artery. What? Two branches of right branch of aorta? I cannot understand your question, Mr. Fassi. If you mean the right subclavian and right common carotid arteries, I have to say yes, these two branches are deriving from the brachiocephalic trunk, and the brachiocephalic trunk is one of the aortic arc branches, the right branch of the arc of aorta. Okay. Okay, very good. So, I am talking about the subclavian artery. Just listen, please. I said the subclavian artery is supplying the blood mainly for the upper limb, but it is also sending some branches for other parts of the chest, for example, and other, like in the neck and this. One of the branches of the subclavian artery is the internal thoracic artery. The internal thoracic artery is a branch which is supplying the blood for the anterior wall of the chest. The internal thoracic artery is supplying the blood for the anterior wall of the chest. The subclavian artery also has other branches like thoracervical trunk, this one, thoracervical trunk, which is sending branches to the thyroid gland and also to the neck. Yes, we have all these arteries in both sides, right and left. So, the other branch of the subclavian artery is the thoracervical trunk, which is sending branches to the thyroid gland and also to the neck. One of the other arteries of the subclavian artery is the vertebral artery. Look at here, this is the vertebral artery. The vertebral artery is, I'm explaining the slide number 12. The vertebral artery here is the artery for the vertebrae and entering the skull and also sending branches to the brain. This is the internal thoracic artery, and this is the vertebral artery, and this one is the thoracocervical trunk. These all branches are in both right and left sides. Listen please, not just in left subclavian artery. Right and left subclavian arteries are the same. They both have some sub-branches. On the right and left sides, we have right subclavian artery and left subclavian artery. All these branches are in both sides. For example, look at here, internal thoracic artery, left internal thoracic artery. Right thoracocervical trunk, left thoracocervical trunk. Right vertebral artery, here, right vertebral, left vertebral artery, okay? We have all these arteries in both sides, right and left. So these were three branches of the subclavian artery. These arteries also have other branches which I explain in next slides. We said that the subclavian artery is sending, look at here at first, look at here. This is the vertebral artery which is entering to the foramen transversum of the cervical vertebra and at the end entering to the skull from foramen magnum through foramen magnum and supplying the blood for the brain. Vertebral artery. It is branching or deriving from subclavian artery in right and left side. This is thoracocervical trunk, and this is the internal thoracic artery, which I said supplying the blood for the anterior wall of the chest. Also, the subclavian artery has a branch with the name of, yes? The other branches of the subclavian artery is costocervical trunk. Look at here, costocervical trunk. For the clinical points, I will explain some of the clinical points in the embryology class. Okay? So here we have the costocervical trunk. The costocervical trunk is sending branches to the neck, and also to the chest. Costocervical. It means it is sending branches to the chest and also to the neck. Here, look at this diagram. We can see the subclavian artery. This is the thoracocervical branch sending some branches to the thyroid gland and also to the neck. This is vertebral artery, I mean this one. And also this one is the internal thoracic artery. It is more important. the internal thoracic artery. Okay, here we have the internal thoracic artery. And after that, the subclavian artery is going to the axilla region, and its name will change. We call that the axillary artery. After that, it is entering to the upper limb. In the upper limb, it is sending a branch with the name of perfunda brachii, and also perfunda brachii, and also is sending two branches, radial and ulnar arteries. The subclavian artery will change its name in the axillary region to the name of axillary artery, and after that, in the upper limb, its name will change to brachial artery. Okay, this artery is called brachial artery. Some of the branches of brachial artery is perfunda brachii. For example, here superior ulnar collateral, inferior ulnar collateral, and these. They are not much important here in this part. Just know the names. But at this part, we have the radial and ulnar arteries. These are supplying the blood for the superior limb or upper limb. At the end, look at here, we have subclavian artery, here we have axillary artery, and here we have brachial artery. It's just a same artery, it has different names in different regions, axillary and brachial. This is the perfunda brachii, and in the cubital region, perfunda brachii is going to the posterior side of the brachium. Look at here, is turning and going to the posterior side of the brachium, and the main artery is coming to the cubital point or region, and after that it is dividing into two branches, radial and ulnar arteries. Radial and ulnar arteries are going downward and making these arcs, superficial and deep arcs in the hand. They are supplying the blood for all parts or muscles and bones of the upper limb. Perfunda brachii and the brachial artery, radial and ulnar. This is radial artery and this is ulnar artery. They are making superficial and deep palmar branches. Yes, they are originating from brachial artery. They are making superficial and deep arcs in the palmar region and supplying the blood for all the components in upper limb. Here also in slide number 16, we can see again the subclavian artery. Look at here, the subclavian in the right side and in the left side. The other artery which is branching from or deriving from the aortic arch was the common carotid artery. The common carotid arteries on the right and left side are supplying the blood for brain and head. Listen please, these are the main arteries of brain and the head. They are going to the upper parts and entering to the skull from the foramen magnum. Okay, from the foramen magnum and supplying the blood for the brain. and also the skull. In next semesters, you will, uh, or for example, the teachers will explain these arteries in more details. But it is enough for me to know just that the common carotid arteries are supplying the blood for the brain. The next part of the aorta is the descending aorta. Descending aorta is starting from T4 vertebra, the fourth vertebra. I said that if we draw a line between the T4 and the T5 disc, the descending aorta will start from this point. Before that, we have the aortic arch. We have seen the aortic arch and its three branches and the arteries of the upper limb from the subclavian artery. Now we are going to talk about the descending aorta. The descending aorta will start from T4 and continue till L4. Okay? The descending aorta will start from T4 and continue until, no, it is not in the sagittal plane, I will explain, till L4 or the fourth lumbar vertebra. From T4 to T12 or the 12th thoracic vertebra, we call that the thoracic aorta because it is placed inside the thoracic cavity. And from T12 to L4, it is called the abdominal aorta. Yes, it is in the posterior mediastinum. The place of the thoracic aorta is in the posterior mediastinum and in the left side of the mid-sagittal plane. Here we have mid-sagittal plane and the aorta is placed on the left side of the mid-sagittal plane, not in the midline. Okay? Yes, left of mid-sagittal plane. And posterior to the left bronchus and also left pulmonary artery. Okay? It is behind the left bronchus and left pulmonary artery. It is placed beside the esophagus. Look at here, this is the esophagus. It is placed on the left side of the esophagus at the upper parts here. So, from T4 till T12 is called thoracic aorta and from T12 to L4 is called abdominal aorta. Now let's talk about the thoracic aorta. The thoracic aorta has some branches. Some of these branches are deriving from the anterior side of the aorta, and some of them are deriving from the lateral side of the aorta. Okay? Some of them are deriving from the anterior side and some of them from the lateral side of the aorta. Which branches are deriving from the anterior side? Listen, please. The thoracic aorta is placed in the posterior mediastinum. So the heart and the lungs and also the precardium, the esophagus, and these are placed in front of the thoracic aorta. Okay? These are placed in front of the abdominal aorta. So this artery is sending some branches to these organs. One of its branches is called the esophageal branch, which is supplying the blood to esophagus. Mhm. The other branches are pericardial. The pericardial branches also sending some branches to the posterior side of pericardium of the heart. Also, we can see the bronchial branches, left and right bronchial branches. These branches are supplying the blood for the bronchi, right and left bronchi. Normally, we have two ones in the left side and one in the right side. We can also see the diaphragmatic branches, the superior diaphragmatic or superior phrenic branches. Diaphragmatic or superior phrenic branches are supplying the blood for the upper side of the diaphragm. Yes, bronchial branches. No, one of them. Look at here. The left bronchials are on the left side, but generally they are branching from the anterior side of the aorta. The bronchial branches normally branching from the anterior side of the aorta. Okay? So, the superior phrenic or diaphragmatic branch are supplying the blood for the superior side of the diaphragm. And also we have some mediastinal branches. The mediastinal branches are also supplying the blood for the organs in the mediastinum. So these are the general branches of the anterior side of the thoracic aorta. Bronchial, pericardial, esophageal, diaphragmatic, and mediastinal. Listen, please, I will give you the break some minutes later. We have also some branches from the lateral side of the thoracic aorta. You're welcome. The most important branches of the lateral side are the posterior intercostal arteries. Listen, please. The most important branches of the lateral side of thoracic aorta are the posterior intercostal arteries, which are called also the segmental arteries. These are the posterior intercostal arteries. As it is clear from the name of these arteries, intercostal, it means that each of these branches are directing in one intercostal space. They are passing in one intercostal space. Here we have one, here in this diagram we can see one of these intercostal branches. Look at here, this is the aorta. It's the anterior side and it is the posterior side. Here we have the aorta and this is one of the posterior intercostal branches. At the time that the posterior intercostal artery is deriving from the aorta, it is just sending a branch to the posterior side with the name of dorsal branch to muscles of the back. This branch is supplying the blood sorry, take sorry, take a break for 5 minutes. And in these 5 minutes, please click on the attendance link. I will send you the link right now. Everybody, please click on the link just one time, okay? Not more. Just one time. This is the attendance link. Please click on the link and share your attendance. We said that the lateral side of the thoracic aorta is sending some branches to the intercostal space with the name of posterior intercostal or segmental branches. Here we have the diagram of the posterior intercostal arteries. Look at here, this artery is sending a dorsal branch to the dorsal muscles or the muscles of the back. This branch is also sending a smaller branch to the spine with the name of spinal branch. Okay, they are supplying the blood for the muscles of the back and also for the spine and for the vertebra, the bone. The other anterior or ventral branch of the intercostal arteries is passing its way in each intercostal space, and it has two branches, one in the upper side and one in the lower side with the name of collateral branch. And also they are sending some cutaneous branches to the lateral sides of the chest. These branches are coming into the anterior side of the chest, and at that time they are anastomosing with other branches of arteries with the name of anterior intercostal. I will explain the anterior intercostal arteries, okay? So, this is a branch of posterior intercostal. Here also we can see each intercostal space. Look at here, this is the intercostal space. We can see the aorta, and also this is the dorsal branch which is supplying the blood for muscles of the back, and also this is the spinal branch of the dorsal one. The spinal branch is supplying the blood for the spine and also the vertebra. Can you see that? The vertebra. The ventral branch is passing its way in the intercostal spaces and also sending the collateral branch like this, and also the lateral perforating or cutaneous branches, and at the end they are anastomosing with the anterior intercostal arteries. In each intercostal space we have three elements: the intercostal artery, intercostal nerve, and intercostal veins. In each intercostal, it's the thorax. Look at here, these are ribs. I am saying intercostal, between the ribs. Okay? No, I will explain the anterior intercostal artery. So, in each intercostal space, we have three elements: a nerve, an artery, and a vein. These elements are placed on the upper side of the intercostal space. The vein, the artery, and nerve. Okay? Vein. Here we can see the vein. Vein is here, the artery, and nerve. V-A-N. Van. On the upper side of each intercostal space. So if we want to send a needle to the chest cavity, it would be better to enter the chest cavity from the lower part of each intercostal space to not injure these elements, okay? If we want to send a needle, for example, for lung biopsy or everything. If we want to send a needle to the chest cavity, it would be better to send it from the inferior or the lower part of each intercostal space to not injure the vein, artery, and nerve. Intercostal vein, artery, and nerves. So, this was the posterior intercostal artery. Now, we said that one of the branches of the subclavian artery was internal thoracic. The internal thoracic artery, which is clear here, can you see that? Is passing its way on the both sides of the sternum, on the right and left side of the sternum. This is the sternum. We have one internal thoracic artery here and one here. In this diagram, we can just see the left side. Okay? This is the left internal thoracic artery. This artery is sending a branch to the pericardium and also to the diaphragm with the name of precardiacophrenic artery. This artery is precardiacophrenic artery. This artery and its vein are passing their ways beside the phrenic nerve, and they are passing through the arc of aorta and also supplying the blood for the precardium and for the diaphragm. Precardiacophrenic. The other branches of the internal thoracic artery are the anterior intercostal arteries. The anterior intercostal arteries are passing their way on the anterior side of each intercostal space and are anastomosing with the posterior intercostal arteries. These are the anterior intercostal arteries and are anastomosing with the posterior intercostal arteries. They are making a circle around the chest. Look at here. They are making it. This is the internal thoracic artery and these are the anterior intercostal arteries. They are making a circle around the chest, a blood circle. The last two branches of the internal thoracic artery is one of them is the musculophrenic artery and the other one is the superior epigastric artery. These are the last two branches of the internal thoracic artery. One of them is musculophrenic and the other is the superior epigastric. The musculophrenic branch is passing in the costal margin and sending the anterior intercostal branches to the 6th, 7th, 8th, and 9th intercostal space. Okay? So, the anterior intercostal arteries in the 6th, 7th, and 8th intercostal spaces are deriving from the musculophrenic artery. But in the first spaces are deriving from the internal thoracic artery. I'm explaining slide number 20. But the superior epigastric artery is going to the stomach, the anterior wall, to the anterior wall of the abdomen, and I will explain that in next slides. The internal thoracic artery is also sending some branches to the mammillary gland from this side, and also it has some perforating branches to the cutaneous part of the chest. So it is supplying the blood also for the mammillary gland. Look at here, in this slide also we can see the subclavian artery. This is the anterior wall of the chest. Here we have the subclavian artery, and this is the internal thoracic artery. The internal thoracic is sending anterior intercostal branches to the intercostal spaces, and at last it will send the musculophrenic and superior epigastric. The musculophrenic also is sending anterior intercostal branches to the 6th, 7th, 8th, and 9th intercostal spaces. Here also we can see the internal thoracic arteries and veins. Here all the anterior intercostal arteries. Okay? In this slide you can see the precardiacophrenic artery. Look at here, the precardiacophrenic artery, the phrenic nerve, and precardiacophrenic veins are supplying the blood for precardium and the superior surface of diaphragm. Listen, please. The precardiacophrenic and the superior to the precardium and superior side of the diaphragm. We said that the other branch of the internal thoracic artery is the superior epigastric artery. Listen please, the superior epigastric. The superior epigastric artery is coming into the rectus sheath and supplying the blood for the anterior wall of the abdomen, and also anastomosing with the inferior epigastric artery in both sides of the body, the anterior wall of the abdomen. It's the superior epigastric, and this is the musculophrenic. The superior epigastric is supplying the blood for the anterior wall of the abdomen and anastomosing with the inferior epigastric. And these are the branches of the musculophrenic in the intercostal space. Now let's talk about the abdominal aorta. When the aorta is passing through the hiatus of the diaphragm, at the level of T12 or the 12th vertebra of the thoracic or thorax, its name would be the abdominal aorta. The abdominal aorta is from T12 to L4. From T12 to L4. The abdominal aorta is also on the left side of the mid-sagittal plane. On the left side of the mid-sagittal plane. And it has many branches. Generally, we can say that the abdominal aorta has three groups of branches. In each group also we have three kinds of branches. Look at here, three groups, 1, 2, 3. And in each group we have three arteries, 1, 2, 3, 1, 2, 3, and 1, 2, 3. Generally, we can say that there are 9 branches of the abdominal aorta. The first group, I'm explaining the slide number 26. The slide number 26. Okay. On the first group, we have the unpaired visceral branches of the abdominal aorta. Listen please, on the first group, we have the unpaired visceral branches of the abdominal aorta. Unpaired means it is just one branch, and visceral means they are supplying the blood for some of the viscera of the abdomen. Okay? Now, one of these branches is celiac branch. The other is superior mesenteric, and the other is the inferior mesenteric. This is the abdominal aorta. This is the celiac trunk, superior mesenteric, and inferior mesenteric. These three are the unpaired visceral branches. Can you hear my voice? Okay. The other group, I'm explaining slide number 26. Look at here, celiac, superior mesenteric, and inferior mesenteric arteries. The second group of the branches is the paired visceral branches. It means some branches which are paired and sending some branch to the other viscera of the abdomen. What are they? The suprarenal branches, look at here, suprarenal branches, the renal branches, and the gonadal branches, testicular in male and ovarian in female. The gonadal means testicular in male and ovarian in female. The next group of vessels are the peripheral branches. It means they are not supplying the blood for the viscera, but they are supplying the blood for the wall, for example, of the abdomen or other parts. What are they? One of them, the inferior phrenic, these ones, the inferior phrenic, which is pair. The lumbar branches, we have 4 lumbar branches in each side. and median sacral, which is unpaired. Median sacral branch. This is unpaired. So we have three groups of branches for the abdominal aorta: unpaired visceral branches, paired visceral branches, and peripheral branches. We will explain each of these branches one by one. These are renal branches. These two. These two are renal branches. Okay? Now, the first branch which I'm going to explain is the coeliac trunk branch. This is one of the unpaired visceral branches of the abdominal aorta. The coeliac trunk branch is dividing and deriving from the anterior surface of the aorta. Look at here, the anterior side of the aorta, and supplying the blood for some parts or some viscera, I mean the stomach, the liver, some parts of the intestine, and the spleen, and also for the pancreas. The coeliac trunk has three branches. Listen please, they are very important. I'm explaining the slide number 27. The coeliac trunk branches. The coeliac trunk has three main branches: left gastric, common hepatic, and splenic branches. Left gastric, common hepatic, and splenic branches. Look at here. The left gastric branch is deriving from the left side of the coeliac trunk branch and sending branches to the stomach, the small curvature of the stomach. The small curvature of the stomach. In these slides, we can't see the stomach because look at here, the stomach is here, but we can't see that. Okay? So, the left gastric branch is going to the small curvature of the stomach and supplying the blood for that part. The next branch is common hepatic. The common hepatic is deriving from the right side of the coeliac trunk branch and passing way to the right side. It wants to supply the blood for the liver. It has a part with the name of left gastric, I said, is going to the left side and supplying the blood for the small curvature of the stomach. Okay, look at here, this is the left gastric and sending branch to this part, the small curvature of the stomach. Look at here, this is the left gastric branch. It's the stomach, and here we have the left gastric branch, which is going to the small curvature of the stomach and supplying the blood for that. Okay? The other artery we said is the common hepatic. The common hepatic, one of the branch is going to the right side to supply the blood for the liver. One of the branches of the common hepatic is the proper hepatic branch. This is the proper hepatic, and the other one is the gastroduodenal branch. So, the common hepatic branch is dividing into two branches. One of them is going downward with the name of gastroduodenal. Here, gastroduodenal. The other is the proper hepatic and going upward toward the liver. The proper hepatic will divide into two branches, right and left hepatic branches, right and left hepatic branches. The gastroduodenal also will send some branches to the pancreaticoduodenal part here with the name of superior pancreaticoduodenal branches. These two are passing their ways here between the head of the pancreas and the second part of the duodenum. I'm explaining slide number 27. Okay? The other branch of the gastroduodenal artery is right gastroepiploic. The right gastroepiploic branch is going to the big curvature of the stomach from the right side. From the right side, I have to finish the slides. Please listen. I'm explaining slide number 28. The right gastroepiploic branch is going to the big stomach curvature from the right side. So generally, the common hepatic has two branches, proper hepatic and gastroduodenal. The proper hepatic will divide into two branches, right hepatic and left hepatic. The gastroduodenal will divide into two branches, superior pancreaticoduodenal and right gastroepiploic. Listen, there would be just a small branch which may be derived from the proper hepatic or the common hepatic. Its name is the right gastric. The right gastric branch also will go to the small curvature of the stomach and will anastomose with the left gastric branch. Okay? This is the right gastric. Sometimes it will derive from the proper hepatic and sometimes from the common hepatic. It's variation. And also here we had the right gastroepiploic. The third branch of the celiac trunk is the splenic artery. The splenic artery is going to the left side and sending some branches to the pancreas and also will enter to the spleen. Look at here, will enter to the spleen. It will also send some branches to the fundus of the stomach with the name of short gastrics. Short gastrics are supplying the blood for the fundus of the stomach. And also the other branch is the left gastroepiploic. Look at here, the left gastroepiploic, which is going to the big curvature of the stomach. The splenic artery has some pancreatic branches and also sends some branches to the spleen, to the fundus of the stomach with the name of short gastrics, and also left gastroepiploic. Their left and right gastroepiploics are anastomosing with each other. So these were the three branches of the celiac trunk. The next branch of the aorta was the superior mesenteric artery. The superior mesenteric artery was also one of the unpaired visceral branches. Look at here. This is the superior mesenteric. The superior mesenteric also is supplying the blood for the intestine, for the small intestine mainly, and also for example, pancreas and these. One of the first branches of the superior mesenteric artery is the inferior pancreatico-duodenal. The inferior pancreatico-duodenal. Okay? The other branches, the most important branches, are the branches for the small intestine. These branches are deriving from the left side of the superior mesenteric. Thank you. Okay? Listen, please. Some of the most branches of the superior mesenteric artery are deriving from their left side of this artery. They are jejunal and ileal branches. Please pay attention. Jejunal and ileal branches. The jejunal and ileal branches, look at here, are passing their way to the mesentery and supplying the blood for small intestine. The upper part are jejunals and the lower parts are ileals. The other branches of the superior mesenteric artery, which are deriving from the right side of the artery, are one of them is the ileoculic branch. The ileoculic branch. The ileoculic branch, look at here, is sending some branches to the appendix, to the posterior cecal branch, posterior side of the cecum, the appendix, and the anterior side of the cecum, and also ascending culic. The next branch is the right culic. The right culic of the superior mesenteric artery is supplying the blood for the ascending colon. Here, sending branches for the ascending colon. And the last branch of the superior mesenteric artery is the middle culic artery. The middle culic artery is supplying the blood for the transverse colon, which has been cut here in this slide. Okay? The middle culic is sending branches to the transverse colon. I will repeat the branches of superior mesenteric artery one more time. One of them is the inferior pancreatico-duodenal. The inferior pancreatico-duodenal is coming here. Look at here. And anastomosing with the superior pancreatico-duodenal branches of gastroduodenal. The other branch are the branches for the small intestine, jejunal and ileal branches, which are deriving from the left side of the artery. Next branch is the ileoculic branch. No, here we don't have a branch for descending colon. The superior mesenteric is just supplying the blood for the ascending, the small intestine, ascending and transverse colon. Okay? One of the branches is the ileoculic, which is supplying the blood for the appendix, for the cecum, and also a part of ascending colon. The other branch, which is deriving from the right side of the superior mesenteric artery, is called the right colic artery for the ascending colon. And the last branch is the middle colic, which is sending the arteries for the transverse colon. Okay? Any question till this part? Okay. Now the last part. Here also we can see the superior mesenteric. Listen please, the superior mesenteric, right colic and middle colic branches. This is the superior mesenteric, ileoculic, right colic and middle colic branches. Now the last branch which we are going to talk about that today is the inferior mesenteric artery. The inferior mesenteric artery is supplying the blood for the descending colon, the sigmoid colon, and a part of rectum. Its branches are deriving from its left side, and one of them is the left colic. The left colic branch is sending the blood for the descending colon, and also has the sigmoid branches, lower left colic and sigmoid branches. The sigmoid branches are sending the blood for the sigmoid part of the colon, and it has also the superior rectal branch. The superior rectal branches are, look at here, this is the left colic, the sigmoidal branches, and this is the superior rectal. Inferior branches of what? Inferior branches of what are abundant? Okay, so we have the superior rectal branches. We are supplying the blood for the upper parts of the colon. Look at here. This is the inferior mesenteric artery. These are the left colic branches for the descending colon. These are the sigmoidal branches for the sigmoid colon. Inferior colic branches are abundant in colon. Listen, all of these branches are abundant. Okay? And this is the superior colic. And this is the superior, rectal branch. The last point that the inferior mesenteric artery, we said we have three general branches, three main branches. Left colic for the descending colon. Left colic here for the descending colon. Sigmoidal branches for the sigmoid part of the colon. And superior rectal and superior rectal is for the upper parts of the rectum. These are the three branches of the inferior mesenteric artery. Now, the last part that I want to mention to you is the marginal artery. It is very important in the clinics. Okay? The marginal artery is so important in the clinic. I'm explaining the last slide, number 32. The marginal artery is forming from the ileoculic branch here, right culic here, left culic, middle culic here, and left culic. These arteries are anastomosing with each other and forming a circle around the colon. And if one of them is, for example, being closed or something happen, the other will supply the blood for the colon. So this marginal artery around the colon has many important role in the clinics for supplying the blood for the colon, each part of the colon. And it is formed by ileoculic, right culic, middle culic, and left culic arteries of superior and inferior mesenterics. Okay? Today we have talked about just unpaired visceral branches of the abdominal aorta. For the next time and tomorrow we will talk about the other parts. If you have any question, please ask, and if not, you can go. Have a good day. Thank you.